Welcome to Wellspring on the Air. I'm Nicole Alfonso, a Wellspring therapist and the host of today's show about why support the cause of mental health. With me today to discuss this topic is the president of Wellspring and co-founder, Tova Kreps, and a therapist with us, Erik Williams. Together, we're going to discuss why mental health matters and how someone can support the cause of mental health. So let's get right to it. Tova, why are we doing this show about supporting mental health? Why is this important for our listeners to know?
Well, I think mental health is very misunderstood still in our society. There's a lot of stigma still around it. It's like, why am I paying to just have someone listen to me? Or, kind of that mystique of they just sit there and they never say anything. So why would I pay for that? Versus there being real medical skills and best practices that actually change people's lives. I think even when you talk about the medical view of it, people wonder, well, if it's medical, why doesn't insurance just pay for it? And why is it so expensive to provide? Some of these things, just the money and the numbers of mental health.
Mm-hmm. Yeah, I think we've never really thought about preparing people to handle hard things in life. It's just like you just go through life thinking, I'll just make it happen, right? And not like equipping, right, with skills and tools and that is valuable, right?
I'm going to just share real quickly because I had a phone call yesterday from somebody who has been a client with us for about 6 months. And she has had different therapists for different family members. She's also done different programs. And she called to give me a testimony yesterday. Like she said, I never knew that you could learn things to change your mental health. Like the bad things that had happened were just always there. They were always going to be a hindrance. That she said, I had no idea there was a skill set. And then I just have to brag because she went on and on. She said, I've had 6 different therapists. She goes, the first one I thought I just lucked into a really great therapist. She said, but then other family members went to other ones. And so far they've gone through 6 different people during different programs. And she said, they're all the same. They're all wonderful. The next one is just as good as the last one. Somehow you have a brand, somehow you have something really happening here. And, but that whole idea that mental health services, counseling can actually change people's lives, and that there's skill sets involved in that, that we can learn and we can grow is why we're here.
Yes, thank you, Tova, for sharing that because sometimes as therapists, we're like, are people benefiting, right? And I know we'll get to those numbers, but I love that somebody's called you and said, this is awesome. You guys have great people working and doing good work. So thanks.
I said, can I record you? This was the best
Yeah.
testimony and the most encouragement I've heard in ages. It was just so lovely. And she says, yeah, I'll help you. I'll write it down or something. So
Thank you for sharing that with our listeners. Now, Erik, I know mental health is important for you on a personal level. So tell us about that. Why does it matter to you?
Well, my daughter had a birth defect and she's had multiple surgeries. And it was after the one she had in elementary school, she was just emotionally impacted and was resentful and just angry. And so she attended a program we have called Bounce. And it really normalized what she went through. It helped her to see that other people go through hard things too. And it really gave her a theology of how to deal with trauma. And so for me personally, for my family, we've benefited from that. And I think secondarily, like we're in a time when I think we realize the effects of mental health in COVID, in the quarantine. One statistic I saw that half the people, their emotional health is impacted due to COVID. And so it's a reality. And I think Wellspring, our organization, has things to offer and help people, whether it's your marriage, whether it's your kids, on a lot of fronts. And I've experienced it firsthand.
And to that point, Erik, I think because we've all struggled through this pandemic, it has destigmatized receiving mental health services to a point, which means many more people are wanting services, right? Reaching out for
Right.
services. And so that brings us to the topic of insurance coverage, right? And Tova, you mentioned health insurance. Let's talk about that first. How is mental health different than other health issues for insurance?
yeah, it's supposed to be the same. It is a health issue. It is in the medical realm. And it's supposed to be the same. But the truth is, statistically speaking, they still way under reimburse, less than what it costs us to provide it. And so the short answer is insurance pays us less than it costs to provide, and we have more administrative burden to do it. So what's happened in our industry is 30% of psychiatrists, psychologists, and therapists take insurance. So that means, 2/3 of us don't take it because it's just complicated and expensive and not worth it and stressful. It really is a sad state of affairs because, like you said a minute ago, people are coming for services more than ever. So we are up at Wellspring 37% from pre-pandemic numbers in terms of sessions. It's like a huge leap for a 1-year change, 1.5-year change. But insurance just really under reimburses and makes it complicated. It's hard.
I think in addition to insurance, a lot of times when you have insurance, it's not really covered in network, it's out of network, which means you have a high deductible. And so you can have a number of sessions before you even touch your insurance coverage. In addition to that, sometimes you come in for just counseling. Sometimes it's career counseling or marriage counseling, and there's really not a true diagnosis. So then there's an ethical dilemma. It's like they're not depressed. And so how is that covered if it's just career counseling? Is that really covered under insurance? So then you put the therapist in a position that you're diagnosing them with something they may or may not need, and it depends on the organization. There's a lot of organizations have no problems diagnosing based on getting better insurance payments, and so but that's something that at Wellspring that we have high integrity. We don't want to do that.
So we have some limits in that area too, right? We have limits on, and we're ethical, so we're not going to say something that is not true.
And the client comes with the expectation that mental health is covered. So they think counseling is covered versus mental illness is covered. You got to prove you have a mental illness. And so I think there's just expectations issues there and frustrations. The mental health providers are paid 20% less than other primary care providers. So the industry itself just has not stepped up yet, even though there is twice now we've had this mental health Parity Act that was legislation that says mental health benefits should be the same as medical and surgery benefits. They've done a new one in 21 called the Consolidation Appropriations Act, adding documentation to require for insurers that they have to prove why they're not doing it. But all that just adds paperwork for the clinicians. And so again, we just haven't equalized in society on it, but people are coming and wanting the help that does make a difference now.
And the truth is that mental health is not a lucrative business, right? Large agencies, hospitals, they're not providing it because it does not make money.
Right. The big hospital systems do not have outpatient mental health services. They'll do inpatient residential or rehab or things like that because it's a hospital stay. But the outpatient mental health loses money. They just won't touch it at all. And that what happens then is it pushes our industry to have solo providers because so really we have a whole bunch of individual practitioners out there. It's the only way you can make any money despite your degrees and all the work you put into becoming a practitioner. So what happens is everyone's out there all by themselves. And for the client, it's terrible. They don't have a brand to trust to go to. You can't go to a Baptist Health because, you know what I mean? They don't have it. So they're left potluck. I found one and, I had to go through 3 to find a good one. A lot of people aren't patient enough to try. They go to one and they say that didn't work and they quit because how do they know if it's got real quality that they need? And but the practitioners are stuck. They have to kind of solo practice in order to make ends meet with it.
And we're trying it as an organization, right, as a big growing organization, to provide these services but stay afloat, right, but keep working, keep doing what we do, which is a hard thing to manage because of all these things. So obviously, mental health has certainly lost a lot of its stigma. We're in a way, we're grateful for that because we do believe that everybody, right, should at some point or another get some help because we all have hard things happen in our lives. Nobody is abstained from that, right? We're glad also for people in the limelight, right? Like recent people like Simon Biles and Prince Harry who had openly spoken about I do, my therapy work, and I've had to do it, and it's really good, right? It's been super helpful. EMDR, Prince Harry giving us that EMDR boost there. So let's talk about the actual value of therapy. How is it really just not talking? It's not just talking and listening, right? There's much more to it, and there's actually research that shows that it does work.
Yeah, there's a lot of research with that. One study shows they surveyed 2,400 people, and 50% of the people showed great results in 2 months, and then 75% after 6 months. I think sometimes we have this expectation that I'll just go a couple of times, and the reality is sometimes if it's been going on for years, if it's more of a long-term addiction, you just need more time for it to work out. And we've seen that sometimes if it's complicated in the course of a year, they really do show improvement in different areas. And so, yes, it is a fair amount of listening, but what's amazing is that therapists are really good listeners. I had a good friend of mine that went through a divorce, and he says nobody would listen to me. They would just tell him negative things to say about his ex-wife, and it really didn't help. And he's like, Erik, you're like one of the few people that know how to listen. And so you're not just dealing with people that listen well, they know what to do about it. And they've seen patterns of behavior and what's worked in other people. And don't you want to talk to somebody that's seen things work? I mean, it's really important to see somebody that's helped other people through something.
I like your comments about the longer you stay in, the better it is. We do some of our own statistics at Wellspring, and there's an absolute direct correlation for the people who see improvement in whatever they came to therapy for. Right now, we have 89% who see improvement in what they came in for therapy for, which is just a really great statistic. But if you take out the ones who only stayed for a few sessions, that number is even higher, because there's a great correlation. The longer you stay in, the more likely you are to really see the improvement. But I think it's about the commitment of the client to do the work, to make the changes, to actually not just come and dump, but to say, what do I need to change in my life, or my thinking, or my healing, or my skill sets, or my go-to soothing things I do, my behaviors. So they begin to work on one at a time. It takes a little bit of time to change patterns and habits and ways of thinking and behaving. So I like that it is successful, and the more you commit to it, the more success you'll find. So, as long as we're talking about our statistics, I want to tell you a couple other fun things out of it. So 89% of our people have improvement in what they came for, but listen to some of the other things that changed in their lives. Our goal is transformational change, but so 89% also have a better improvement in their ability to manage their emotions. 79% have better relationships with their family or significant others. 76% improved in their physical health and self-care. 85% had a reduction in stress management, and 91% said they had an improvement in their overall quality of mental health. That's just exciting. That's just our own client surveys. And I know it's true across the industry. It's not just at Wellspring, but because there are really best practices that make changes in people's lives.
It's amazing.
Those are amazing statistics. Those are awesome. Thank you for sharing. We're doing really good work. So we're going to go ahead and take a short break to thank one of our sponsors who makes the production of our podcast possible. When we come back, we'll hear more about the many ways to help pay for therapy. Welcome back to Wellspring on the Air, and this is Nicole, your host today. If you're just joining our show, our topic today has been about why do we support the cause of mental health. If you joined us late, you can find us on our favorite podcast channel on Wellspring on the Air, or on our website blog page at wellspringmiami.org. Just search for this topic. So far today, we've talked about the complications as far as providing services and having the resources to continue providing services for our communities. Okay, and so I want to continue on by asking, why is counseling so expensive to provide?
So, well, part of the expense is that you're dealing with therapists with advanced degrees and advanced training. They also have specialized training for different things like addictions or marriage or trauma training. And so, in addition, there's supervision. So therapists aren't just getting a license or passing a test. There's actually supervising They're actually under supervision for a number of years. And then even after they've got their license at Wellspring, they have other therapists that mentor them and ask questions. So part of the expense is just the education and the supervision and the expertise in different fields.
Yeah, therapists, I used to laugh at myself. I thought for the same amount of training, I could have gotten a law degree and maybe made a lot more money. Not maybe, I'm sure I would have, and so I think as a whole, they're overeducated and under reimbursed in terms of proportionate to that education. And so, yeah, we want to pay our therapists so they stay in the field and love their work and are experts at it. But from an administrative standpoint, Nicole, there are also a lot of other expenses people don't even realize. So we have all these HIPAA guidelines. And so we have to have an electronic medical record platform. And just that platform, every time we add a therapist to it is $3,000. I mean, just off the top. And so people are like, well, it's telehealth, so you're not paying for an office, so you should be so much less expensive. We are paying for an office. It's a telehealth office that we have to pay for that, make sure everything is HIPAA compliant and all of these things. All of our technology has to be HIPAA compliant, all these details. We have to pay for liability insurance. Even our board has to have insurance because we're a nonprofit. We have overhead administration who corrals our therapists together, who motivates and cheers them on and makes sure they get the training they need and keep up with them. And so and then of course billing is its own nightmare to manage and an expense. So it really costs the same as it does any other medical practice.
Yeah, it's running an organization and every aspect of it. I'm glad you said that because I think oftentimes we don't understand that there's so much more that goes into running an organization. Now, who should pay for mental health services?
Well, that's a good question. I think what we've seen is that when people are investing financially in their own mental health, then they respect the process more. Then they're more likely to show up for appointments and more likely to do the homework. And so they just need some skin in the game to value it. And so it doesn't mean that they can always afford the full cost of it, but it gives them some incentive to realize the cost. And then they just appreciate it.
Yeah, so the person themselves needs to be, I want this for me, right?
Right.
Yeah.
Yeah, one of the reasons I set up Wellspring is that before that I had worked on staff at a church and the therapy was free. And what I realized is there were people who came over and over but didn't do the work. It just became like an extra friend for free. And other people, and they'd miss appointments because there was no fee charged for canceling or things like that. So I really do profoundly believe that people need to have skin in the game, as Erik, as you put it. We need to invest in our own therapy. Financially usually helps us feel more invested. And so I think philosophically at Wellspring, that is something we always say. Everyone needs to pay something. It may be $5 for someone who's homeless or $2, but they're going to do something that shows their commitment. Philosophically, the other group of people I think should help support mental health are the stakeholders in someone's life. And so I think sometimes we put it all on the individual. And the truth is some of us should be invested in our friends, in our family, in our fellow church members, in our employees. And there are some people who really do that, but family members, it's really okay for family members to support someone in the family financially in order to do this. I have supported a few family members and, there you go, because I'm deeply invested in them being well and healthy and making our family gatherings more pleasant, and it's important. And I think employers, we do have some companies that support some of their employees because they value mental health and they want to keep their people healthy. And I think that's an honorable and an appropriate thing to do. We have churches that sponsor people. One dysfunctional church member can really cause problems in a church, one person who's really off. And so recognizing as a church, we're a community and we need to be a healthy community in order to do kingdom work. And we can't be healthy unless all of our members are healthy as individuals. And so there are churches who support and are stakeholders also in other people's mental health.
Yes. So I want to say something here because a couple of years ago, my husband and I had a conversation as a mental health counselor. We were having a conversation about how he could offer it for his team because he has a small firm. And he got to a place where he's like, you know what, I'm going to give them a $2,000 stipend a year to get mental health services. And guess what? They are a healthy company. They're a healthy people working together, right? And I love that he's doing that. That's just a really like big deal, I think, because you're more effective, productive. You can work together as a team better. I mean, there's so many benefits to when you're working with someone that's healthy, right?
Oh, that is so beautiful. I know of a church that does that gives all of their staff a stipend, and it's really added to their salary, but they don't get it unless they use it. So they just have to turn in the receipts, and it's paid for. But they get to go to anyone they want, anywhere they want. But it's a stipend. Sounds like your husband's doing something similar. So what a beautiful thing in valuing the health of our employees. That's great.
Awesome. So what happens if someone can't afford counseling?
Well, one of the missions of Wellspring is to make our services financially accessible for clients. So that we are a nonprofit. We're not out here to make money. We're out here to help people get services. And so we work really, really hard to find ways, one person at a time, to help make sure they can get therapy.
So how does Wellspring do that? Like practically, how does Wellspring help clients to pay for services?
All right, so we do a variety of things. One of the things we do is apply for grants. So some of our grants are geographic, in other words, by where the person lives. They have to have financial needs, but it's related to where they live. So for instance, Ocean Reef Community Foundation is for Homestead and the Keys, and for people who have financial needs there, and they are very generous in terms of giving us some money to help support those people who live in that area.
And then you have the Key Biscayne Foundation, the Coral Gables Community Foundation, which really provides services for people in those areas. And you might be surprised that that people have financial needs, but all areas have people with financial needs, and so they value it. And I think those communities can do better for it. And so that's a great. Those are some great organizations.
And I think it goes back to them being stakeholders in the mental health of their community. Healthy people make for a healthy community, and so they are actually stakeholders in their region and their community. We also apply for grants that are specific to a program or to a population. So we have a Miami-Dade County grant for our Bounce program, which is for traumatized youth. And that provides that program for free for any youth living in Miami-Dade. And Nicole, you're the director of that program, so I should let you cheer that on, but it's a great program. We also, for instance, I got a little grant this year for running a pilot for working with equine therapy and foster youth. So we'll be doing that next year. So that's like a specific grant for a specific population or a specific modality. And we have a few others of those. They help us launch programs or sustain programs, and it's great. So that's one of the things we do to reduce it is apply for grants.
So other ways that we do help our clients is by hosting fundraising events. And we have two coming up. One is called Friendsgiving, and that is going to be on November 13th. I'll be hosting both of these events. And Friendsgiving is going to be a gathering that we have that we'll have a talk about internal beauty. And so it's an event for us to fundraise specifically for our youth. And of course, then we have Give Miami Day. And Give Miami Day is November 18th. This is a day for all organizations, nonprofit organizations in Miami. And it's an opportunity for all of us to receive funds for whatever needs each organization has, of course. As a non-for-profit organization, we need to sustain our services and everything we provide to our clients. So this is a huge day. We have a goal that we want to meet during that day, and we invite you to have Wellspring be your Give Miami Day foundation, because like we mentioned before, there are so many people in our community that need our services, and we want to be able to say yes to everyone. We don't want to have to not provide services. So we have this financial aid fund that if it has money, then we could be able to support anybody that comes for services to us.
Well, I'm excited about those days coming up. I'm excited, Nicole, that you're going to be hosting those for us. And this podcast is part of us launching that and letting people know that there are good reasons to support mental health. Another thing that we do, we've already talked about it briefly, is that we facilitate sponsorships. So we work on our end to make it simple and easy and confidential for a family member or a church or an organization to sponsor somebody for therapy. So we'll make sure the consents are signed, and the consents are for really the financial part. It's not like, oh, I sponsored you, so I get to know how you're doing in therapy and what you're working on. That is, kept out of it, but you do sign off the release that someone knows that I showed up or not, because then we ask them to pay. So we just facilitate that whole process. So it's not so awkward for the client to go ask for the help from somebody else or for someone to offer it. So we facilitate that. We facilitate that even for organizations and corporations if they sponsor their own employees. An example might be maybe they've got somebody on probation, as an employee, and they don't want to lose them. They want to invest them. They think it's a mental health issue, and that if they made a little progress, that they could keep them as an employee. I think that's so valuing of people and employees, and so we will facilitate that kind of thing too. And maybe they really do, the or sponsoring organization really does need to know a little bit about progress being made. So we will hand tune what's in those consents so that progress can be made and people can be sponsored. So that's just what we do. We work really hard to facilitate those sponsorships.
Awesome. Any last ways that we do also continue to help financially?
Well, yeah, I think you kind of hit on it when you talked about our fundraising campaigns. But the truth is, what we do is discount fees. So we just literally lower the rate for people who apply for financial aids. And that's kind of our core thing. By raising money on one end, we reduce on the other. And we've made a commitment at Wellspring to take 10% of our revenue budget. And that's the amount, at least, that we give away in discounts every year. So we literally tithe our own money coming in order to give discounted fees for people who apply. And it just feels really good. Our goal is to get people in. If they want therapy, we try to find a way. They've got to invest some. We invest some. Their family and community invests and grants. And so somehow we try to find a way. And, that's what we work really hard at.
And so one of the things that we're asking you to do is, if you're listening, if you benefited from this show, if you benefited from the podcast, if you sent a child to one of our bounce camps, would you consider making a gift, or would you consider reaching out to family and friends, or talking to your church to make a sponsorship? It's really a team organization. And so we need your help in that. This is something that we can't do on our own, but we need the network of people that have been touched by this show. This free show that we provide, to maybe make a one-time gift or a monthly gift, or to mobilize people in your family to give. Maybe you're financially at a place that you can't give, but you know people that could give and who contribute, because you've seen it firsthand.
It does make an impact in people's lives, and generational impact when people get help.
You wrap that up well, Erik. And our verse for Wellspring is Proverbs 4:23. Above all else, guard your heart, for it is the wellspring of life. And really, this is about guarding our hearts so that we can live well, love well, serve well in our lives, in our community, and literally just be happier, more abundant lives. And so to do that, we have to guard our hearts. And that's what counseling is about.
Thank you both. Obviously, we hope this podcast helps demystify the money sense of counseling and why supporting mental health is a valuable cause. That leads us to our wrap up. Why support the cause of mental health?
Mental health is a key issue. I think it's been at the forefront of our country right now. And so, but how much better is it when we're dealing with something, whether it's a trauma or a marriage issue or depression? Like, it's easy to try to rescue somebody and end up drowning yourself. And so whether you're at a church and it's somebody in your small group or somebody in your family, if you feel the effects of it. And so why not get professional help? People that are trained with eating disorders and not just trying to figure it out, not just trying to hide that and keep that a secret. Why not help your kid that's depressed because they've been on Zoom for too long and not seeing their friends? Why don't you talk to people that have helped others, and therefore it's benefits you, your family, your church?
Yeah, I think why support the cause of mental health? Because people need help, as Erik's described, and because therapy actually works.
That's right. That's it. That's our wrap up. So thank you again, both of you. Is there any other way that people can support the cause of mental health? Last, anything?
Just give and encourage other people to give. Sponsor people that you know in your family. So don't be afraid to reach out. If you've got questions on how to do that, come to our website, call, email.
And normalize it. I think normalizing the process of getting help, right? I think all of us have at some level gotten help, at least here in our organization. We do believe that, and we believe we should do our own work. So continuing to destigmatize mental illness.
And then if you can donate, that'd be great. Give Miami Day or go to our website. We have a donor page, or offer to help a family or friend in this process. And that's how you can support our cause of mental health.
Yes. Awesome. Thank you. Donate, donate, donate. It will be of benefit to someone. So it's time to close out this show. Thank you all for joining us today. We hope you learned something new today about mental health and have been encouraged to support mental health for someone you know or through Wellspring. Again, if you joined this program midstream, you can find this show and others on podcast at Wellspring on the Air or on our blog on wellspringmiami.org. Encourage us and let us know you're listening by sending comments or questions to ontheair@wellspringmiami.org. It's time to wrap up. This is Nicole with Wellspring on the Air, because hearts and minds matter.